Alive. All right. Good afternoon, everyone. We are here in Glastonbury, Connecticut at MedSpa 1064 with Dr. J and myself. I'm Steve. My name's Steve Winward from Cynosure, and we are going to be talking about one of my favorite devices and procedures today, SmartLipo. A little background on Dr. J and MedSpa 1064. This incredible facility was opened in 2005, right?
Yes.
Awesome. And you've treated what, over 18,000 patients already so far? That is incredible. Your dream when you originally told me about it was to create Connecticut's premier aesthetic laser center, is that correct?
Yep.
I think you've done it. I mean, this facility is incredible. You've done an amazing job.
It's thanks to my staff. We love being here.
Good. Well, I'm happy to be here today too, and especially talking about SmartLipo. So I know you're an expert. I think you're by far, have the most experience in Connecticut with this treatment. So that's why we want to talk about it today. I know you offer many other aesthetic and skin rejuvenation treatments, but SmartLipo is a favorite.
SmartLipo is one of my favorites.
Good.
Yeah.
Good. Well, thank you again for having us. We're so happy to be here today. And can you maybe start us off by giving a little background into what SmartLipo is and why you like it?
Absolutely. I love SmartLipo. SmartLipo is laser-assisted liposuction. So it's part lasering, part suctioning out the fat, and it's permanent fat removal, which is amazing. And it's an office procedure. We do it right here, no general anesthesia, you don't need an IV, and the fat is gone forever. The advantage of the laser that you guys make is that it also tightens the skin. So we get skin tightening, we get permanent fat removal, and it's a one-time deal. And the results are truly amazing, as you will see in a minute.
Truly amazing. Yeah, we actually have a few patients here today, so I think we're going to start off with Suzanne.
Yep.
Thank you so much. I'll switch seats with you
All right.
Come on in.
and do a little mini consult for today.
So this is Suzanne. Suzanne and I have already talked.
Yep.
And we have done a formal consult. Suzanne is interested in SmartLipo, and she's going to tell us a little bit. Tell us what your concerns are. What's your goal?
So my concerns are for the fat underneath my chin and the areas on the side. I don't have a profile, or much of a profile, so I want to get that nice and tight.
Okay. Suzanne looks great, right? And she has very little fat. She thinks she has a lot of fat, but she doesn't. Commonly what happens is you're at a wedding, somebody takes a picture from the side, and you start to see that there's a straight line here, or there's a little bit of a double chin, right?
Mm-hmm.
So if you look at Suzanne, and I'm gonna have you just right there, this is what can go. In addition, when we do the procedure here, we also tighten the jawline, and everybody at a certain age, even though you're 28 now, this is what happens. You get the dropping of the cheek and you get the jowls. After SmartLipo, you can expect that jawline to be tighter and the jowl to be gone. This will be gone and the skin will be tighter. There'll be a nice curve here. Show the side. Okay, so she's a great candidate. We've already talked, and I'm really looking forward to doing it. She's gonna be thrilled.
I'm very excited.
What should she expect before, during, after the treatment? I mean, what are her goals? I mean, can you just walk us through everything that's
Yeah,
before
so
and
she'll
after?
come in, she'll spend about 2.5 hours here, and she will not feel this procedure because we're gonna do numbing. Once she's numb, we can laser. That takes maybe half an hour until I'm happy that it's warm and it's where I want it to be. Then we suck out the fat with a very thin cannula. It's about 2 millimeters. Again, she's not feeling this. If she were to feel something near the edge, we just put a little more numbing in. The fat is sucked out. There's no stitches involved. There'll be a little piece of tape here, and she will wear a lovely wrap around your head that Velcro's on top. It'll keep everything tight, and I will see her the next day. I'll see her in a week. I'll see her in a month, and as often as she needs me.
And do you have to use general anesthesia for this treatment?
There's no general anesthesia. You don't need an IV. Some people like to take a little bit of a relaxant just so they don't get nervous when they see me and the instruments. And the jokes are much funnier when you take a Xanax.
Right.
Dr. J, we have a question from someone online asking, does this procedure work to tighten the jowls?
So it does work on the jowl area. It's great for here. This is where most of the laxity and the loose skin is in most people who are older. But it will tighten the jowls, and it actually will get rid of some of the fat that's hanging down here.
Awesome.
Who is a typical candidate for this procedure?
So it's an interesting question because it tends to be genetic where people put fat. Some people will do it in their 20s and 30s. We've had two sisters who came in and had it the same day. One didn't want to look better than the other. But mostly it's people in their 40s, 50s. As you age, your skin gets a little bit looser, the fat becomes a little bit more prominent. So the age varies from 20s to 60s.
And how long does that treatment take?
So you'll probably be here about 2.5 hours. We don't rush, we want to take our time. We want to make sure that you're comfortable, and you'll probably need a ride home if you take any kind of medication to relax you. But I've had people sleep through the procedure, and I've had people drive themselves home.
So it sounds like it's a very safe procedure.
It's a safe procedure. It's a great procedure. I love doing it. So we've already talked about some of the complications that are possible but are extremely rare.
And is there any multiple treatments needed? Is there one treatment, two treatments, three?
So generally it's a one-time treatment. Once those fat cells are removed, they do not come back, no matter if people would gain weight in the future. The skin gets tighter, and 20, 30 years later, the skin may be a little bit loose, but that's just normal aging. So it's really a one-time procedure.
Another question, how long do you wear the head garment for?
So that's a great question. So the garment is 4 days only. When you leave here, you have those little pieces of tape, some foam, and we put that on you. We'll see you the next morning, and then it's 3 more days.
Excellent, excellent.
Now, I should say that this procedure, we're talking about the chin, but it is good in other areas. It is wonderful for the arms, sometimes the abdomen, hips, and it really has to be an isolated area. It's not weight loss procedure, but it is a great contouring procedure. Those areas that bug you, that you cannot work away, you cannot get rid of with diet. We all put fat in our bodies in different places, and some people, it's out of proportion. We can bring them back into proportion, and then they look great.
Excellent.
How would you compare this treatment to traditional liposuction?
So it's very similar. We have the advantage of actually doing it under locals, so we can do it in the office. And the laser is key to this because it melts the fat. It fires 40 times a second, so it disrupts the fat cells. And the heat that melts the fat has an effect on the collagen in the skin. And over a period of months afterwards, you actually get skin tightening.
And would you say there's less downtime as well?
There's definitely less downtime. It's 4 days of wearing the wrap. You may have a little bit of bruising for a week. The masks are great bruise cover-uppers, by the way, these days.
Excellent.
That's
Okay.
awesome. Do you want to?
Thank you, Suzanne.
Thank you, I can't wait to
Thanks
see
for
you.
coming in. I can't wait to see you. Can't do without you.
Yes.
Okay, now we have another wonderful star. This is Diane. And Diane has had the procedure already, so you can ask her questions. I believe it was 5 weeks ago. Yeah, thank you for coming in. And Diane had her follow-up today at the 5-week mark. And I'm gonna show you her picture. This is Diane the day of the procedure, and this is today.
It's incredible.
Yeah, and I think these results speak for themselves. So if you have questions for Diane about her procedure, what it was like, the recovery, please.
Maybe Diane can walk us through her experience if you don't mind.
Right, like, I was a little upset being a 54-year-old woman, having all the sagginess. And again, with the pictures, I was frustrated every time that I had seen a picture. I had double chins, it was sagging over the course of time. Unfortunately, it does happen. I started thinking about it, researching it, seeing pictures before and after. I had seen a picture on Med Spa, and the difference was just absolutely amazing. So I started doing some extensive research into who could be the best doctor. I obviously, anytime anybody wants to go see a doctor, you have to do the research, and all my research led me to Dr. J with his unparalleled experience, and he was the best one in Connecticut that I came across. So I booked my appointment. The staff was wonderful. They went over everything. Dr. J explained everything. There were questions that I wasn't even thinking of that he explained everything. I felt completely comfortable with it. I knew it was the right decision. The day of the procedure I came in, the staff was wonderful. He went over everything. They put the numbing in, the sensation, no pain whatsoever. You could have it like when you go to the dentist, you could feel, the prodding and everything, but no pain whatsoever. It was exactly the same like that. And the results afterwards, I'm thrilled, absolutely ecstatic. I feel younger. When I'm not as sad when I look in the mirror. I'm thrilled.
Well, Diane looks great. So this is a 5-week result. The results continue to improve for a period of 6 months. But she's probably about 70% of her final look. There's a little bit of laxity here that will tighten over a period of time. The really skin starts to tighten about this time, and that will continue to improve, and we'll see Diane in 6 months and get final photos. But that's 5 weeks.
It's incredible. Dan, would you send anyone that was interested in treatment like this, would you send your friends, your family to Dr. J for this?
100% anybody. I was telling all my friends that, sort of had the jowls and the fats. I'm like, you should have this done. It's absolutely amazing. It could be a little bit, it's not exactly $100 procedure, but it's forever. And that's what attracted me with it, that this lasts forever. I will never, even if I gain weight or lose weight, it'll still look the same, which for me was just amazing, absolutely amazing. So I'm beyond thrilled with this.
Well, thank you.
Love it. Any other questions coming in so far?
What different areas do you offer SmartLipo for?
So the chin, as we're talking about today, is very common. We also have done arms, and it's a phenomenal procedure for the arms because there is really no good alternative for people who have the thicker fat on the posterior of the arm. The surgical option is available, but it leaves quite a large scar. With SmartLipo, the opening is really about 1/4 of an inch, and that may be a small little scar right by the elbow. And just from that area, we're able to reach the entire arm and get rid of the fat and tighten the skin at the same time. Now, everyone gets a consult, and we don't do it on everyone. We want to make sure you're a good candidate, make sure you're happy at the end. So I would say arms are very important, hips, the outer thighs. Some people have what's called saddlebags, and they can't get pants that fit. So it's a wonderful way to contour and sculpt someone. We've done it on abdomen, knees, other areas as well.
That's awesome. And I know, Diane, you had mentioned that, this isn't it's not a cheap procedure by any means, but because of how wonderful you are and how this team is, SignShare today is going to be kicking in an extra $200 credit towards anyone that wants to book that's on the WebEx today. So a nice little incentive to come visit our friends at MedSpa 1064.
Yep, worth every penny. Absolutely worth every penny. I am ecstatic, just thrilled, absolutely thrilled.
Well, thank you very much for the kind words, and thank you to SignShare for helping out. Again, when you do come in, you will have a consult, and we'll sit down individually and go over this procedure, what to expect, and I want to make sure that you're happy, you're getting the right results. So we don't do it on everyone who wants it, and that's why it's individualized, and we get very happy patients.
Very happy patients. Felt like I was the only patient of the day.
You were.
I was.
Love it.
Dr. J, we have
Yes.
another question coming in. Can you compare and contrast Thermage with SmartLipo
Okay.
specifically for the neck and jowl area? Like, why would someone choose SmartLipo versus Thermage and vice versa?
That's a great question. So Thermage is a non-invasive way to tighten skin. It's not a laser like SmartLipo is, it's radio frequency energy, which is what's in your remote control at home, just much stronger, and it does not melt fat. So if somebody has pure skin laxity, Thermage may be an option for them. Thermage is acting through the skin into that lower layer where all the collagen is, and SmartLipo is right under that layer. So thank you. So the advantage of Thermage is that it's non-invasive, no downtime, and it tightens skin. SmartLipo melts fat, a little bit more downtime because it is minimally invasive.
Excellent, thank you.
Incredible.
I think that's it for questions.
That's it?
Yeah.
Fantastic.
Wonderful.
Thank you
Thank
all
you,
for joining
everyone.
us. Hope you learn to love SmartLipo as much as we do.
Come into MedSpa 1064 and book your consult.